great seminar today. Sanya Nishtar, who many of you know, is going to present on a book that she's just published with Oxford University Press called Choked Pipes, which is really a very impressive assessment and prescription with respect to the Pakistani health system.
The health systems are the conduit through which you deliver any disease-specific intervention. And in countries like ours, if they're choked, if they're not functioning, you won't be able to achieve any endpoint by intervening in that area. So implicit in this title is the understanding that something fundamental needs to be done to open up these clogged pipes. The book is essentially about reform of Pakistan's mixed health system. But I seem to have the sense that the strategy presented and the analysis may have some level of appeal for other developing countries as well. When the preview of the book was held in Havana last November, Adenike Grande, a health minister of Nigeria, was a panelist. And when I sent her the book to read through prior to the panel, she said, I thought I was reading a description of health systems of Nigeria. There are several considerations that make it relevant to other developing countries. The description of the mixed health system syndrome in particular, and the description of challenges in each health systems domain, and the potential agenda for reform that has been proposed are some of these considerations. I'm sure it can be argued that any health system is mixed, but by definition a health system is mixed when there's publicly funded government service delivery coexisting with privately provided market delivery, and where out-of-pocket payments are a major means of health financing, and my understanding is that in most developing countries that is the case. Essentially what the mixed health system syndrome says that there are a triad of determinants which are inadequate public funding for health, an unregulated burgeoning role of the private sector, and lack of transparency in governance. And the three act together in a very complicated way to undermine the equity and quality of health service.
I would like to congratulate Sanya with the publication of your book, which is really based on a rare combination of qualities that you have. One is the ability to really dig deep into data. Two is the insights you have and analyze all these different parts of a health system. And three, the stamina you have to actually put it all in one book.
She has done a superb job. This is the first, most comprehensive book about the health system in Pakistan. She enjoys respect as a public health professional. She knows the system.
One of the merits of the book is this notion of mixed health systems syndrome. And I think that is very important because it's an issue that indeed affects many, many countries in the world, and that has certainly here in WHO for a long time been an absolute blind spot.
It would be a big question for us as an organization and our response to Sanya's publication. I would think that the questions that we should be posing to ourselves would be, what can WHO do to catalyze the transformative change in countries? Situation and issues, as you have presented them in Choked Pipes, really reflects many of the same issues and the situation existing in many developing countries.
There are some things from reading this that other countries could easily learn from. She talks about insufficient funding for health, common problem. Financial risk protection for the poor is a fundamental problem and an issue that she takes up. And then finally the issue that Wim touched upon, how you use resources, are they being used to get the best out of those resources? Common problem everywhere. She has some suggestions.
I would really appreciate if this somehow could also feed into the next country cooperation strategy that the organization develops in Pakistan.
In the context of being stimulated on many, many fronts in this. I mean, I think this is one of the strengths of the book, is that you've got a level of analysis such that you get below the macro clouds of the health system and really into subsystems and specific functions and dysfunctions.
I realize that I have been very ambitious in what I've tried to achieve. As far as I'm concerned, it's been a labor of love. Nobody's asked me to do this book. Nobody has asked me to invest time in studying Pakistan's health system. This is not commissioned work. This is not funded work. and I have done it with great expectations that this will at least be a starting point for thinking in my country. And from my conversations with friends around the world, I'm very humbled to learn that it may have meaning and relevance for other developing countries.
Choked Pipes, Reforming Pakistan's Mixed Health System by Dr. Sania Nishtar. This is a significant work in which the author provides the first consolidated review of Pakistan's health system.
She is the foremost scholar and thinker in the public health sector.
Sania has painstakingly collected data on different dimensions of the public and private health systems, from governance to service delivery, from medicines to human resources, and presented it in a very concise volume.
A book of enduring work must have three dimensions. First of all, it should contain analysis. Secondly, there should be synthesis. And the third is that there must be an actionable agenda coming out of a good work without getting into the realm of amorphous rhetoric. And I honestly tell you that if you were to look at these three principles and apply them to this work, then Dr. Sania Nishtar, you have passed all the three tests.
She has put forward an important reform agenda for consideration and action, outlining the prevalence, the relevance of the following strategic roadmap. Sania is offering a solution to the health challenge facing Pakistan through a feasible, effective, and affordable reform paradigm. WHO commends the work of Dr. Sania Nishtar and recognizes her as one of the luminaries in global public health.
I'd like to talk about the two motivations that I've had to write this book. One of them was domestic and the other were related to my work in global health. Pakistan is undergoing very troubled times. There are many internal security threats. There are the realities of globalization that the country has very limited capacity to cope with. There are fiscal space constraints. And on top of all that, the need to target welfare to the people of Pakistan has never been more dire as it is right now. And opposed to all these realities, the capacity of the system to target welfare to its citizens is very weak. So this book and the reform agenda that I have experimented with in a way in terms of its articulation is a very humble attempt to put forward something in black and white with a view to lending impetus to a renewed dialogue, to new strategic thinking about the need to look at things in a very different way, and about the need to leverage and harness all resources of the economy towards the goal of development.
I'm delighted to present another Oxford book, Choked Pipes, Reforming Pakistan's Healthcare Systems by Sania Nishtar. This is a significant work.
This rare privilege to co-host an OUP book launch is indeed an honor for me. When I read Sania's dedication, and I quote her words, Choked Pipes is dedicated to the silent and unjustified suffering of millions of individuals for whom the right to health remains unrealized, and whose lives I strive and aspire to touch. Unquote.
But it is a book that is larger than the sum of its parts. She virtually hasn't left any aspect untouched. The book is a landmark and a milestone. It makes an outstanding contribution to the informational dimension in three respects. Number one, it enhances the level of awareness and knowledge that all of us need to have. Second, it's an excellent input for discourse within the health sector on a technocratic level. Thirdly, it acts as a marvelous bridge for the health sector of Pakistan and the global health sector.
The distinguishing feature of this book is that it contextualizes the healthcare in the larger socio-economic context. It takes the whole governance structure of the country and shows that you cannot really have an island of excellence in any particular sector without looking at the larger picture.
This higher standard of governance is a recurring theme in Choke Pipes, which reflects an extensive analysis of the health system of Pakistan and in its review of all the components finds challenges of governance and weakness of regulation.
This unique book, written by Dr. Sania Nishtar on the affairs of health management of our country, Pakistan, is a systemic scientific analysis of failure of a health care system happening right in front of us since the last 60 years. This failure is not God-sent disaster, but 100% man-made. I will just conclude with a verse from Shakespeare before inviting Dr. Sania Nishtar to conclude the proceedings. Purity of heart, the peace above all earthly dignities, a still and quiet conscience.
For me, the book is something that mirrors the broader performance of our state system. So when you think health, when you think education, when you think population, when you think the social sectors, or when you think about any other state system, do not think that it is a sector in isolation, because the functioning of the broader state system impacts in each and everything we do. The poor functioning that we see as part of the inherent culture of our institutional systems is a combination, A, of lack of policy consistency, B, the lack of basing decisions on evidence, and C, the lack of transparency within our systems, as a result of which graft has become pervasively institutionalized.